Hello and welcome to the group room where we're at the 34th annual CTRC-AACR San Antonio Breast Cancer Symposium. I'm joined now by Dr. Partridge, Clinical Director of the Breast Oncology Center, Director of the Program for Young Women with Breast Cancer, Associate Professor of Medicine at Harvard Medical School. Welcome.
Thank you.
You know, I may be on the side of controversy here, but I really do believe that it's important for young women to do self-exam. And, you know, I know that that's not necessarily agreed upon because it could lead to unnecessary surgeries. Sure. My feeling is it's unnatural to think suddenly at age 40 now, start to know your breast and start doing self-exam. If you begin to know your breast when you're young and you begin to understand, oh, that's a cyst, oh, that goes with my period, oh, there's something here not normal, and you demystify your breast and you become familiar with your body, that it only enhances your sense of responsibility to yourself. I found my breast lump on self-exam, and working with so many young women, it seems like many other young women also find something because they examine their breasts. What is your feeling and what is the general consensus on breast self-exam?
Right, so what you're alluding to is that the randomized trials that have looked at this issue in populations where the routine was not to do breast self-exam, so you really would expect to see a difference, were negative in that randomizing women to, and this was a large study that was done in Southeast Asia, randomizing women to routine monthly self-breast exam, daisy pattern, trying to, you know, formal self-breast exam did not improve how women did in the long run compared to not doing that. Does that mean that women shouldn't examine themselves or know their own bodies? Absolutely not. My take on that is, and I agree with you, the vast majority of young women find their own lumps or their partner finds it, and sometimes it's a doctor. The vast majority of young women pick it up on their own, and it's either self-detected and it's by a symptom or nipple discharge or something else. But I think there's a difference between or maybe there isn't a big difference between doing a regular, rigorous monthly self-exam versus what your average woman does when she's showering and washing. And most women do feel their breasts on a regular basis, is my take on that. And therefore, to see a difference between this rigorous monthly self-exam versus what a woman and how she understands her body in a day-to-day didn't change how people do. So that's my gut on it. So I tell women they should absolutely be aware of the feel of their own breasts, and whether for them that means some kind of structured exam, I'm okay with it. For the majority of women, they tell me that, you know, they don't want to have to do that if they don't have to, but I say, you know, you really do need to know what your breasts feel like.
Yes.
And I think the way people interpret that varies.
Exactly. Thank you, Dr. Partridge. Dr. Partridge is the Clinical Director, Breast Oncology Center, the Director of the Program for Young Women with Breast Cancer, Associate Professor at Harvard Medical School. They're lucky to have you there in Boston.
Thank you.
You're welcome.